Welcome to Episode 2, HIPAA and PHI in Plain English, where we unpack the essentials of health information privacy and security. The Health Insurance Portability and Accountability Act, better known as HIPAA, affects nearly every organization that handles medical data. Yet many professionals find its terminology confusing and its boundaries unclear. Understanding HIPAA in plain language matters because it helps reduce accidental violations, avoid costly breaches, and build patient trust. When people know what the law expects, they can make better daily decisions, whether configuring access to a system, sending an email, or managing third-party vendors. This episode focuses on practical clarity, showing that HIPAA is less about red tape and more about responsibility for personal health information. HIPAA applies to specific organizations known as covered entities and their partners. Covered entities include healthcare providers, health plans, and clearinghouses that process health information electronically. Business associates are vendors or service providers that handle this information on behalf of covered entities, such as billing firms, cloud storage providers, or consultants. The law's scope extends beyond hospitals to any company that touches patient data within these relationships. Recognizing where one fits in this structure is critical because HIPAA obligations follow the data, not just the organization type. Understanding your role, whether as a provider, plan, or partner, defines which safeguards and agreements apply. That clarity sets the stage for compliance that is both correct and efficient. Protected health information, or PHI, is the cornerstone of HIPAA. PHI refers to any information that can identify a person and relates to their health status, treatment, or payment for care. This includes obvious items like names and medical record numbers, but also indirect identifiers like dates, phone numbers, or even biometric data. PHI can exist in paper form, electronic files, or spoken communication. A key point is that the protection applies wherever the information travels, not just within clinical systems. For example, a spreadsheet containing patient contact details stored in a shared folder qualifies as PHI. Knowing what counts as PHI helps professionals apply appropriate safeguards in every context, not just inside hospital walls. One of HIPAA's most practical ideas is the minimum necessary principle. This rule means organizations should only access, use, or disclose the least amount of PHI needed to perform a specific task. In practice, it limits broad data exposure by tailoring access to job duties. For instance, a billing clerk may need insurance details but not medical notes, while a clinician may need treatment information but not payment records. Applying this principle reduces the risk of accidental disclosure and enforces good data hygiene. It also reminds staff that privacy is an active choice in daily operations, not just a policy written in a handbook. The minimum necessary rule embodies the idea that less exposure equals less risk. The privacy rule defines what is permitted and restricted when using or sharing PHI. It allows data use for core functions such as treatment, payment, and healthcare operations without requiring specific patient authorization. However, it limits or prohibits sharing outside those areas with written consent. This distinction ensures that patient trust remains intact while still supporting essential business processes. For example, disclosing PHI to another provider for care coordination is allowed, but sending it to a marketing partner without consent is not. Understanding these permissions prevents well-intentioned but improper disclosures. The privacy rule structure balances practical care delivery with individual privacy rights. Complementing the privacy rule, the security rule focuses on how PHI, particularly in electronic form, is protected. It outlines 3 categories of safeguards: administrative, physical, and technical, that work together to secure information systems. The security rule requires organizations to assess risk, implement controls, and document their protection measures. It is intentionally flexible, allowing adaptation to different sizes and capabilities. For instance, a small clinic might use simpler security configurations than a large hospital, but must still demonstrate reasonable protection. The key message is that security must be both appropriate and active, ensuring that patient data remains confidential, intact, and available when needed. Administrative safeguards form the organizational backbone of HIPAA compliance. They address governance, workforce training, and risk management. This includes assigning a security officer, conducting regular risk assessments, and defining procedures for incident response. These measures translate policy into behavior. For example, periodic training ensures staff recognize phishing attempts or report lost devices quickly. Administrative safeguards also require role-based access management, making sure each user has the right privileges for their duties. These processes prevent many breaches before they happen. By treating administrative safeguards as continuous rather than one-time tasks, organizations maintain awareness and accountability across all levels of staff. Physical safeguards focus on the tangible environment that holds PHI facilities, workstations, and devices. They include locked server rooms, badge-controlled entry, screen privacy filters, and secure disposal of paper records. Even with strong digital defenses, physical lapses can expose sensitive data. A misplaced laptop or an unlocked file cabinet can become a breach source. HIPAA emphasizes that security extends to walls, doors, and desks, not just firewalls and passwords. Regular walkthroughs, visitor sign-ins, and clean desk policies all support this safeguard family. By combining simple discipline with thoughtful design, organizations protect both digital and physical aspects of privacy. Technical safeguards deal with how systems enforce privacy electronically. They cover access controls, authentication, transmission security, and encryption. Each user must have unique credentials, and systems should automatically log out idle sessions. Encryption helps protect data in transit and at rest, turning it unreadable to unauthorized users. Audit logs record who accessed what, creating traceability for investigations. A good example is email encryption. Messages containing PHI must travel securely across networks. These controls demonstrate that technology, when properly configured, supports privacy rather than complicates it. Technical safeguards translate trust into measurable system behavior. HIPAA also defines what qualifies as a breach and how organizations must respond. A breach is any unauthorized access, use, or disclosure of PHI that compromises privacy or security. When one occurs, organizations must evaluate its scope, document their findings, and notify affected individuals within specific timeframes, usually 60 days. The notification must explain what happened, what information was involved, and what steps are being taken. Regulators may also require reporting for larger incidents. Understanding these timelines and procedures ensures a prompt, transparent response that upholds public trust. Preparation through a defined breach response plan often determines how well an organization recovers. Business associates and their agreements are another critical part of HIPAA compliance. A business associate agreement, or BAA, is a formal contract between a covered entity and any vendor handling PHI on its behalf. The BAA defines each party's responsibilities, reporting expectations, and liability in case of a breach. Without it, both sides risk non-compliance. Common examples include cloud service providers, billing firms, and analytics companies. These agreements extend HIPAA's reach into the supply chain, ensuring that privacy protections remain intact beyond an organization's own walls. Establishing, reviewing, and updating BAAs regularly is both a legal and operational safeguard. Despite clear rules, myths and mistakes persist. One common myth is that small practices are exempt from HIPAA. They are not. Another is that encrypted data cannot be breached, which ignores insider misuse and weak passwords. Some assume verbal disclosures are outside HIPAA's scope, but spoken PHI counts equally. Frequent mistakes include oversharing patient details in emails or failing to train staff on new systems. These errors often stem from misunderstanding rather than neglect. Addressing them through education and practical examples helps organizations build a privacy culture instead of relying solely on compliance checklists. Knowledge and habit together make HIPAA sustainable. HITRUST and HIPAA are closely related but serve different purposes. HIPAA sets the legal requirements for protecting PHI, while HITRUST provides a structured way to prove that those requirements are met. In other words, HIPAA defines the what and HITRUST defines the how verified. Many organizations use HITRUST to demonstrate HIPAA compliance through certified assessments. The HITRUST controls map directly to HIPAA's privacy and security rules, turning abstract expectations into measurable assurance. This relationship helps organizations streamline audits, reduce redundancy, and build consistent trust with partners. Using HITRUST as the assurance overlay brings clarity and credibility to HIPAA programs. HIPAA's intent is not to burden, but to guide organizations in protecting health information responsibly. When understood clearly, it empowers professionals to handle PHI with confidence and care. From identifying what qualifies as PHI to applying the minimum necessary principle, every concept ties back to trust. Clarity in these rules leads to better communication, safer technology use, and smoother collaboration with partners. By pairing HIPAA's foundation with HITRUST's assurance model, organizations can achieve both compliance and confidence. This understanding provides a practical orientation for building privacy and security into everyday operations where it matters most.